and about 80% of the poorest will be living still in fragile environments, probably in 2030. There's 120 million people living in humanitarian need in 2018. And I think these are statistics which you've all seen. Probably the one which we wouldn't usually think is that 200 million people are affected by climate change hazards. So we're talking about promoting health through water and sanitation. And of course, water and sanitation are important components, particularly of children's survival and development, as the new Sustainable Development Goal says, ensure availability and sustainable management of water and sanitation for all by 2030. Whether that will actually happen is very hard to say. It was hoping to be happening by 2015, but it didn't. And of course, so when we look at water, sanitation, hygiene in terms of children's health, obviously key areas of health there are the diarrhea range and how you deal with the diarrhea range, because that's one of the main components of death and poor hygiene in things. So when we look at water, it's not only about water that we drink, it's about the amount of water that we've got available for washing, and it's also about whether you actually live near water or not. So you have a range of diseases, particularly in emergency areas, which are relating to water that you drink, obviously cholera, typhoid, dysentery, all those areas. Equally important is also adequate amounts of water for washing and also your hygiene. And if you're living in a swampier area where there is surface water, it's very likely that you might be affected more by malaria and those sorts of areas. So when we're looking at water, we're looking at the linkages, that water thing. So obviously the link is health, HIV, nutrition, and 85% of diarrhea deaths are due to poor hygiene practices and contaminated water, etc. So those what we see the main link. But of course, there's also the link to education, because those if you have WASH in schools, and that affects the number of people that very often will come to school, particularly girls, and therefore if no adequate water sanitation is available in schools, then you find that younger girls won't go to the toilet, and older girls will find that toilets, particularly at the menstruating time, are not that they won't go. So you lose a thing. But of course, poverty is also 5 billion people lose productive days a year due to diarrhea and what have you, fetching water and household and things. So poverty is a key part of what you need to provide when you're providing water. And of course, the gender issue to do with that, even though that's not absolutely everywhere, women and girls tend to carry the brunt of picking up and carrying water. So water, you've either got too much of it, as these floods are in Colombia, or you have water which is actually desperate for where people going to, to collect their only water. These are Rwandan refugees coming in from over the Kagera River in Rwanda in '84, and of course, people who move into an area will think they will always be looking for water. But of course, there are the obvious opposites in some of the refugee camps in northern Kenya, or in areas like this, which are extremely dry and where water is very much at a premium and actually quite difficult to get to. You then have earthquakes, like the Haiti earthquake we had in 2010, and also in just a year or so before that, we had a major earthquake in China, in Sichuan. So you've got all sorts of environments. The thing in Haiti 2 years before the earthquake, they had a major hurricane and storm, which brought 2 meters of mud and water into this is the second city in Haiti. And of course, mixed up in all these natural things, we've got the military, and we've got conflict situations, which we have in so many things, and why people move. This is people coming out of Libya during the conflict in Libya a few years ago. In Syria, we have still got major conflict. This is just very close to the Turkish border. This is in Gaza, where after one of the Israeli airstrikes, which not only bring the buildings down, it also damages all the water and sanitation sectors. And of course, we hear now regularly about Yemen, and we hear about refugees coming in from different parts of Syria and now Afghanistan and wherever. But of course, in camps, this is the Zaatari camp in Jordan, which at the time, a few years ago, was actually the biggest camp in the world. This is what you now have when you look at Cox's Bazar after the Rohingya refugees coming into there. You see that the refugee camps, and this is just one of the camps. This is at Cox's Bazar, but there are camps a bit farther down from Cox's Bazar and others. And those camps have been there, and I remember visiting them in '93, visiting Rohingya camps in this part. But of course, when you have a traditional camp, as I say, particularly in the drier areas, and this is in Darfur in the Sudan, you see this is a common site. It's a common site in all emergencies, and of course, you see people walking to collect water wherever they are. This is in South Sudan, where a temporary water, because it's a very dry area, you have to bring in water to this area. And in refugee camps, whether they're in Burundi, as this one is in Burundi, or in Goma, probably one of the biggest camping areas which the agencies dealt with in the 90s, when 94, when over 1 million people moved into the Goma area, and this is one of the camps with 350,000 people in it. Now, in Rwanda, things changed different. The Rwanda crisis, which you may or may not have remembered, the Goma, the genocide inside of Rwanda. But what that crisis did, it changed things. After the Rwanda crisis, many changes took place. Sanitation and hygiene became a much more key part of the work of water, because up to then it was very much about water. It was also sharing of experiences and development, and between the key agencies, wider uses of academic institutions and students for research, and more evidence on what we saw as hand washing in soap. And what came out of that was the SfGH project. I don't know whether any of you are familiar with the SfGH project, but it was set up with NGOs and the Red Cross movement. And it basically laid out some minimum standards that you should have in water, sanitation and hygiene. But it also covered areas such as health, nutrition and shelter. So I'm not going to deal with those today. I'm just going to mention that SfGH Handbook, which has just gone through its fourth update. And this is the one from 2019. It looks at the minimum standards in hygiene, water supply, excuse me, water management, vector control, solid waste management, etc. And it's all in the context of a humanitarian response. So if we, first of all, if we briefly look at hygiene, you have a lot of areas of work around hygiene that you need to communicate and work with different communities, the community, how you do it, monitoring sections, as well as dealing with the people who are actually going to try and put in water. And of course, one of the key parts of hygiene is hand washing with soap, which we've heard so much about over this last these last few months. And these pictures are from some time ago. So this is not only about what's happened over the last 3 months, but over what's happened over the last 15 or 20 years. I put this in because at the moment, 3 billion people, 40% of the world's population, do not have a place in their home to wash their hands with soap. So we have 3/4 of the access of water sanitation in the world's poorest countries amongst them, which comes down to about 1 billion people are immediately at risk from COVID-19, simply because they have a lack of basic hand washing facilities. And if you didn't know, 2 days ago on Thursday, it was a global hand washing day. The global hand washing day was started in 2008, in New York with the Secretary General, and I was fortunate enough to be there at the time and took part in the ceremony. And there's been a hand washing day ever since, even though most of us probably don't know what that means. So hand washing things have gone on in terms of hygiene promotion. This is in rural Damascus. And therefore you have signs around about water, even in Damascus. Just a minute. In the schools, it's very important that you work with schools and hand washing, and this is what UNICEF does a lot of. It was behind the hand washing day, and it regularly deals with schools on the hand washing day. But it's not only about hand washing. Hygiene is about messages to people, and the messages in different places will vary. This is in Haiti, a very very sort of raw, very explicit sort of message, which actually you wouldn't be able to use, for example, in hygiene messaging in say, Pakistan. It wouldn't be suitable for Muslim countries. But mostly to do with packaging of hygiene is to do with posters and things to explain. This is a poster which I've just put up, done by the Water Authority in Haiti during the cholera outbreak that they had a few years ago. And of course, on the back of the hygiene thing, I can't go forward without saying the importance in an emergency of menstrual hygiene, particularly for women. And this has a lot of things to do with health protection thing. But of course, I guess one of the main issues to do with that is to do with protection. Protection of women and girls who don't have adequate, safe facilities to change themselves and do things and what have you, and makes them very vulnerable thing. And of course, the other thing is that of dignity, and it's important that sort of dignity is a part of the issues that you're going to deal with. So hygiene, in the hygiene world, menstrual hygiene is very, very important, and it's taken forward a lot. So I'm just going to go over through a bit of excreta management, sanitation, in other words. Excreta is a safe, these are the standards laid down by SfGH. In fact, what they are indicators. They're not really standards, they're indicators. So the main one is that excreta is safely contained in on-site to avoid contamination. Sounds a bit obvious, Second one is that people have adequate and appropriate and acceptable toilets to allow rapid, safe and secure access at all time. And the key word there is secure, because one of the biggest areas that the High Commission for Refugees have in refugee camps is rape. And rape is around where you have cited badly your toilets and your sanitation facilities and not provided adequate protection for those, particularly for women. And if you don't have lighting around those things in camps, women won't go to those places to do the toilet, and that applies to washing as well. So the word security is a very, very important issue in terms of how you cite sanitation. It can be basically straightforward, but of course, sanitation is as much about cultural reliefs and others as it is about the physical setting up, even though more recently, the agencies have got more and more professional about providing toilet facilities, so that instead of just digging a hole in the ground as they used to do, they're now providing a much more professional things. In the earthquake in Sichuan in China, the Chinese did a big thing on sanitation and wouldn't allow any pit latrines to be dug in, only wanted proper facilities for their people. But of course, also there's a range of options when you're doing sanitation, and a lot of the work in certain areas can be done on composting toilets. So just now to go into a bit on water and see how that looks in terms of the standard indicators for water is that you should be providing for cooking and personal hygiene at least 15 litres per person per day. And you should try to ensure that a household does not move more than 500 metres, have to walk more than 500 metres to get that water, and that there shouldn't be any queuing times if more than 15 minutes. But if you've been to almost any refugee camp, you realise that people will be sometimes queuing for hours. It also should be that it shouldn't take more than 3 minutes to fill a 20-litre bucket, and that your water sources should be maintained and looked after on a regular basis. So your options on providing water, of course, is chlorine tablets if it's household stuff, bought water treatment, water tanking, water trucking to tanks, and pumping from wells to tanks, extending all your options. In terms of water tankering, it happens in most places as the first option. It's the most inefficient way of doing it, because you've only got the water within inside of the tanker. When you get yourself organized, you put tanks up and you dispense the water into tanks, so your tankers can do 3 or 4 trips to the one normal trip. But of course, it depends upon where it is and how long you're going to be in there. And it may be that you're just going to be working with the water authority, as in down in the bottom left-hand corner, mending pipe work or setting up systems which will allow you to go provide water. And I think in certain places, this is in South Sudan, where there isn't any sort of very much available water in certain areas. You set up, in this case, onion tanks to do the provide water. One of the agencies that have done a lot with water, of course, is Oxfam, and you may or may not know that. But Oxfam's had water kits for the last 20 or 30 years, and they're used by all the agencies, the Red Cross, and even to a certain extent MSF and others. And it's really about setting up, having the equipment ready to set up in a place. This is in Sri Lanka at the after the tsunami, and this is in Satari camp, where there are 1,500,000 litre tanks set up as the main storage area, and you'll see just on the left tankers bringing in water to to those tanks. They then run that water out round the camps to smaller tanks. And this is just as they're setting up a smaller one. That's why there's no drainage around. Excuse me. It's for people to do what they can straight away to get water out into the different areas. And that is a sort of like a standard procedure. Now, in 2004 and 2005, again, two key things happened. One was Darfur and the disruptions and genocide they said was happening in Darfur. And the other one was Sri Lanka and Indonesia for the tsunami. And again, you may or may not remember those things. What happened after that was that the DEC, the Disaster Emergency Committee in this country, raised £300 million for the NGOs to operate there. Almost every government in the Western world went into the tsunami area to help. In Sri Lanka, for example, 19 different national militaries went in to Sri Lanka to help. And all the donors went in to do things. And as you could imagine, to try and coordinate all that effort was a disaster in a way, as well as the disaster of the tsunami. And it was from that the United Nations decided it needed to do a review of the reform to see how the world responded to large-scale emergencies in all the sectors, not just the water sanitation sector, but in all the sectors. And there was a review done by the United Nations, and from that review, the humanitarian response review, 3 central pillars came out for humanitarian work. One was the cluster approach, which I'll say something about in a moment. One was humanitarian coordinators in the UN need to have more effective work, and the restructuring of the United Nations humanitarian funding system, and also trying to work with the governments to get a much more coherent policy of funding from government. All that sitting on a partnership of everything. Now, what they set up in there was the cluster approach. Now, again, you may not have heard about the cluster approach, but they looked at all the main areas: health, logistics, nutrition, protection, shelter, and what have you. And they set up with the key UN agencies to set up a committee that would involve NGOs, it would involve the UN agencies for different things. The water and sanitation was set up by UNICEF. I was fortunate enough to be the person that UNICEF pulled in to set up the WASH cluster. So I spent 4 years setting up and running the WASH cluster. The WASH cluster was made up of NGOs from the Oxfams and Red Cross and all the rest of it, as you see. The Red Cross, ICRC and things, UN agencies, UNICEF, WHO, High Commission for Refugees, OCHA, consortiums like SCER and Interaction, which is the consortium of American agencies, institutions like CDC, Center for Disease Control, which we've heard a bit about recently, the American setup, and donors, which was OFTA, the Americans, DFID as it was, it's now not changed, is with the British, ECHO, Senate, NORAD, and all the rest of it. And the vision of that cluster was actually to increase coordination and response and quality of national coordination platforms, and to focus on how to do a much more effective job, a more predictable job. The clusters, the WASH agencies themselves, we're looking at a goal to improve the predictability, the timeliness, the effectiveness of comprehensive of a WASH response to humanitarian crisis. That vision is the one which is there today. It was slightly different vision from what I had 10, 12 years ago, but that's the vision of the WASH cluster which is put out today. The WASH cluster is made up of a strategic group, coordinators, information officers, and what have you, that when there's a crisis, and it's used mainly in a major crisis, not in a small crisis, in a major crisis, like the Ebola crisis, things where they would go in and work with the government and the humanitarian coordinator to the United Nations, to the Secretary General, would have some agreement with the government in country what clusters they would want. Would they want health and water and nutrition or whatever? And they would go in and organize the agencies under that umbrella. So that the health cluster, for example, would work with the Ministry of Health in a government, in a country, and the health agencies would work under some sort of coordination to make that work. Now, just to put forward a few challenges now to go down this line of an overview from the World Bank says that, that in 2050, 70% of the world's populations will be urban. So that means that the biggest cities will be found mainly in developing worlds. Despite the megacities, a majority of urban migrants will be moving to small towns and cities. Cities in developing world will be sorry, I just moved my dog out. Cities in the developing world probably will absorb 90%, 95% of the growth over the next 2 decades. And what they found that in low-income countries, in urban environments, on the whole, slums and people living in slums are more malnourished than what they are in the rural areas. So dealing with urban emergencies are quite difficult things to do compared with dealing with, say, refugees on a large site. And that's because you've got political problems in cities that you have to deal with. You have structural problems and you have social complexity problems. You virtually have virtual movements of people in the flexible areas for planning and data. And in urban environments, space particularly is very often very, very difficult and needs a lot of creative solutions. Flooding is one of the areas which will happen inside of this was in the Philippines a couple of years ago. And what you find out this is in Sierra Leone during the war, where people congregated in the central a stadium, and therefore you have to deal with people on a sort of an urban basis. And of course, one of the greatest challenges is how you deal with the huge numbers of people which are now gathering around cities. And this is in Freetown in Sierra Leone, where all the way around the cities and the things you have now slum areas. I worked in Sierra Leone in the late 60s, and all this was just swamp area then. So these are some of the challenges which are coming up. And of course, in a war situation, your water authority, despite the fact that it is actually against international law to damage water facilities, you do find, in this case in Baghdad, where a major pipeline which affects a third of the population of Baghdad was actually hit. And of course, when you have earthquakes, particularly, you have a lot of rubbish and waste and what have you. And this is in Haiti, where lots of the rubbish after the earthquake was moved out. And of course, the same happened in Sri Lanka and in Indonesia after the tsunami, where waste was moved out. And this waste is full of all sorts. It's got medical waste, there's all things. It's very, very dangerous. And of course, you will find on these places, which are usually people light these things up, so everything is burning all the time. And you have families and children playing and also collecting stuff. So it's a very, very dangerous environment to be going on. Now, in terms of innovation stuff, emergencies are very good for bringing out sort of innovative devices for hand washing, for women's urinals, for urine, different types of designs of things. This pea bag toilets, which are bags which you can actually put on top of a tin or on top of anything else.
Paul, sorry to interrupt. You've got about 5 minutes until we have some questions, if that's okay.
Okay, well, let me just do 3 seconds over to get to finish these things through then. These are the last 3 things of innovation stuff which is going on now. Solar powered installation, P-power things from different universities, the University of West of England, something about humanitarian response. It's a dangerous place these days, humanitarian response. This was an attack of, world is changing. We've got lots of problems these days, as well as COVID things, climate change, urbanization. If you're interested, UNICEF have just brought out 2 new booklets, one, Water Under Fire, about emergencies, development and peace. And the second volume is Strengthening the Sector Capacity. And that's it. Thank you. Finished. Hello.
Hi. Thank you so much, Paul, for that lecture. It was just amazing. Thank you so much.
Yeah.
We have some questions for you now, if you can answer them. So the first question is, what is the balance between implementing short-term immediate relief for wash issues and putting in place more sustainable solutions, especially in long-term protracted conflicts and standing refugee camps, for example?
Yeah. Well, there's a lot of discussion now about realizing that we've always thought that when you do water in the first place and sanitation, you should be thinking of the long term. Now, it depends upon what the government of the country that you've moved in allows you to do. In places like the Sudan, in Uganda, for example, where the government has always been sympathetic towards refugees, therefore, when you're doing your emergency water there, you should always be thinking of the long term, because the government is probably going to make that refugee camp into a settlement or resettlement area. Therefore, you should always be planning that whatever water facilities you put in, if you should be looking at that on the long term. One of the problems that the agencies have, and the UN has as well, that its emergency facilities, say in UNICEF, are separate from the development facilities within inside of UNICEF, because one is in the program division and one is in the emergencies. So there is a need, and that applies to Save the Children Fund and Oxfam and other agencies, and there's a need to bring this together. Now, it will, there's a lot of problems at the moment in terms of, the COVID things, but countries are realizing that they don't want agencies in just doing their own thing. And therefore, even countries like Bangladesh are now saying, I think, we want a restricted number of agencies and then a restricted. So there's a lot of pressure on the UN now and agencies to make their approach much more developmental. I don't know whether that answers your question or not.
Yes, that does. Thank you so much. So the next question is, how did you get involved in the field of wash?
How did I get?
Yes.
I was an engineer, first of all, and then I was fortunate. I went on a Commonwealth Overland expedition to India, and then I went on VSO for a couple of years. And when I came back from VSO, I knew I didn't want to deal with, I was an engineer in the aircraft industry. I knew I didn't want to be an aircraft engineer. I wanted to deal with people. And after a couple of years of teaching in different places, I joined Oxfam in '75 as a second engineer. And I stayed in Oxfam for 37 years. including 4, 5, 7 years of that, I was seconded out to the United Nations to do the same thing, basically, that I was doing in Oxfam, but to do it under the UN. So I think it was something which I never regret. And if any of you are interested, whether you, I mean, most of you will be from the health side, there is enormous need for good people, health people with commitment to join the health agencies or the UN or UNICEF or whatever, because the need is absolutely enormous.
Okay, thank you. The next question is, how do you navigate the politics of situation? For example, some groups may exploit wash services.
So, sorry, hang on.
How do you navigate the politics of a situation? For example, some groups may exploit wash services.
Yeah, right. Politics are a very, very difficult issue in any emergency. I think the issue is that you really need to know a little bit about the politics of what's going on when you join it. WASH is is probably seen by many people as less politically important than health. I mean, I know that in different war zones, if you are a health agency or your ICRC, you come under maybe a lot more pressure than you do if you're the water authority. So in certain war zones, we've gone under the badge of the water authority and tried to manage. It's because water is a physical thing, slightly different from sanitation, which is less physical, and hygiene. It's sometimes quite dangerous to operate because you've got to be on site all the time. So the important thing is to your agency has an understanding of what the politics are, and you have an understanding of what the politics of the thing are, and you just really do have to be careful. And in war zone areas, you have to report every day, and you get a report every day on the security of a particular situation, because you all operate under what they call security guidelines, whether you're in the United Nations or whether you're in Save the Children Fund or Oxfam. And in a war zone area or a difficult war, the security guidelines will be upgraded every single day. So you have to be very, very careful about how you operate, but you still have to operate.
Perfect, thank you. As students, what do you suggest is the best way to get involved?
Well, I guess the important thing is that you need to finish your courses. As students, you need to finish what your course is, and then you need to get some experience. I wouldn't recommend that you leave your course and go straight, out to try and join MSF. I think it's probably valuable that you do 1 or 2 years in whatever aspect of the health system you work in, so that you actually have some actual operational experience about health from whatever point of view, whether you're being a doctor or whether you're being a nurse or whether you're training to be a midwife, because that experience will be needed if you decide you're going to leave and join an agency. I know many doctors who feel strongly that that they're quite happy to back out of their surgeries for a short period of time, 3 or 4 months, so that they can actually put those skills into place. But I think the important thing is, and that applies to engineers and people as well, you do need to have some experience to go in and work with the agencies. And in urban environments, for example, if you were a health person, there's a good chance you'll be working with the Ministry of Health in that country, maybe in a hospital or in a clinic or whatever. And this is where your actual operational experience counts.
Thank you, that was great. Kind of leading off from that question, engineering and the involvement of engineers in global health is key. How do we get engineers more involved in humanitarian work, such as So
So
just
how,
like what you've got involved in.
how do we get engineers more
Involved in humanitarian work?
Well, I think there's two things. One, that engineers, there is a thing called Red R, which I'm a part of, registered engineers for disaster relief. There's about 1,600 engineers, and they could be seconded out through the agencies to involved in the emergency side. There is an increasing amount of need for urban engineers, people who most of the technical staff in the agencies are experienced with doing what I would call greenfield sites, which refugee camps. Engineers, if you're interested, there is Engineers Without Borders, which actually has a group in Plymouth, which I spoke to earlier this year. There's, if you're in another university or any other area, there will be Engineers Without Borders in lots of different places. Red R run a number of practical courses for engineers. We did one 3 weeks ago, a virtual course just like this, in different parts of the country. But when the lockdown is not on, we do practical courses connected to Exeter area and in Kent area, where we do a weekend for engineers to come along, get an understanding of what the problems are in refugee camps and things and what have you, how to put together some emergency equipment, tanks, pumps, how to operate those sorts of things. So there is a lot of opportunities around if engineers are keen to do it, because and student on the health side, MSF and others are also keen to see experienced people come their way.
Okay, perfect. I think that's time up for Q&A. Yeah, we still have more questions if you want to answer it, or I don't know what everyone else.
I mean, if there's any more questions around with time, my email can be put out, and people can email me, and I'll do my best to answer any questions from any of the people who are in the conference. Because I'm conscious that we're trying to keep to time, and I was a bit slow getting my thing off the mark today. No, so I apologise for that. My fault. I don't know what's up with this computer, but anyway, I'd be happy to to answer any questions by email if people want to ask me.
Yeah, I was going to say, if it's okay as well, we still have questions in the document, so we can send over the document, and if it's okay, you fill that out, and then we'll send it back to all the participants so they can see all the answers.
Okay.
Thank you so much, Paul.
That's okay. I'm sorry late, but we got there in the end.
No, it's been wonderful. Thank you.
All right, we're just going to move on to a quick break for